Can I change the shape of my Asian eyes with eyelid surgery?
The desire for double eyelid fold or eyelid crease drives the overwhelming popularity of Asian double eyelid surgery. Asian eyelid surgery does not describe only one type of surgery. The term Asian eyelid surgery can include procedures from any one of the following examples. A young person who lacks a fold and wants a double eyelid fold. A middle-aged or older person with sagging skin and fat pockets. An individual with drooping eyelids caused by weak muscle referred to as ptosis. Someone who has a fold of skin covering the inner corner of the eyes called the epicanthal fold, who wants the eyes to appear larger and show more of the inner corner of the eyes. In the next few minutes, I will discuss how I evaluate and plan with my patients the shape in double eyelid surgery. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have been performing non-incisional and incisional double eyelid surgery throughout my career, as well as epicanthaloplasty and eyelid ptosis surgery for patients of Asian descent. I am known for my natural-looking aesthetic style with eyelid surgery, as well as my methods to achieve shorter healing time and less postoperative swelling. People who come to see me for consultation are always concerned about how their eyelids and crease will look like after double eyelid surgery. In particular, they express their interest in looking natural after surgery. So I show them how their body would naturally have had an eyelid crease. I do this by using a Q-tip or an instrument to lift the eyelid skin to create a fold to demonstrate what the eyelid crease can look like after surgery. The anatomy of the eyelid is important to understand. The backbone of the eyelid is called the tarsus, and this structure is used to determine where the eyelid crease would naturally be and is important when surgery is performed. In addition, the muscle which lifts the eyelid, called the levator muscle, is very important in defining the new eyelid crease. When a natural crease is present, there are connections between the levator muscle and the skin. In Asian double eyelid surgery, whether I use the non-incisional or incisional method, a connection is made with the suture to this muscle to create a crease. The simulated eyelid crease also helps me determine whether the crease would be naturally tapered downward toward the inner corner eyelid fold or epicanthal fold, resulting in a nasally tapered crease. If the eyelid skin at the crease runs parallel until the skin blends towards the nasal bridge, this is called a parallel crease. Some people come and see us with pictures of their favorite celebrities' eyes and want that shape for their own eyes. This provides me an opportunity to help my patients understand the anatomical aspects that determine eye and eyelid shape. These aspects include bone structure, the presence of fat, the amount of skin present, the soft tissue, and the relative prominence of the eyes. So it is important to recognize the limits of the anatomy, which if compromised can impact the health of your eyes. As with any eye cosmetic procedure, health and function of the eyes should never be compromised. I do discuss how the procedure I perform can result in something comparable to the celebrity but is unique to the individual patient. There are two primary objectives of double eyelid surgery. The first is to turn a single eyelid fold, also known as a monolid, to a double eyelid fold. The second objective is to make the eyes look bigger and more open, which adds a look of vibrancy and vitality to the whole face. Having eyes that look bigger is not just a sign of beauty in Asian culture, but amongst all ethnicities and cultures. When someone questions whether these procedures conflict with ethnic character, I respond that the procedure being performed makes the eyes look bigger by revealing the true shape of the eyes. Before the procedure, the fold effectively defines the shape of the eyes. After the procedure, the eye's true shape is revealed, which shows the beauty of Asian eyes. After I show my patients where the eyelid crease would be naturally placed, measurements are taken and assessments of any extra fat or eyelid skin is done. Measurements are important to determine where incisions are made and how extra skin can be removed if necessary. Excess fat above the eyelids is also assessed, as the presence of fat can affect the formation of the eyelid crease. Generally speaking, little to no fat is removed routinely. For non-incisional surgery, strategically placed marks are placed where small openings will be made to engage the skin with the levator muscle. During the actual surgery, patients are routinely given light IV or intravenous sedation, followed by some local anesthetic. This approach allows for my patients to recover comfortably and walk out of our office without difficulty. I prefer this approach over putting patients under general anesthesia, which often results in more swelling, longer recovery, and other issues such as postoperative nausea and vomiting. In situations where there is no redundant or extra eyelid skin and no excess fat above the eyelids, which is common in younger patients, I usually choose to perform the non-incisional method of double eyelid surgery. This method involves making small openings in the eyelid skin to pass a suture through. The sutures are placed to create a connection between the eyelid skin and the levator muscle. The connection points between the eyelid skin and the levator muscle cause the skin to fold, and this fold is where the eyelid crease forms. If there is extra fat above the eyelid preventing the crease from forming and excess eyelid skin that partially covers the eyes, then I would perform incisional double eyelid surgery. Excess skin is precisely measured to the millimeter before a thin strip of skin is excised. Through this approach, some fat is removed when needed. Sutures are then placed to close the incision and to engage the eyelid skin to the levator muscle to establish the eyelid crease. After surgery is completed, swelling occurs in varying degrees. To manage swelling, patients are advised to use cold compresses for the first 2 days. After 2 days, patients are encouraged to be more active to help the circulation clear the swelling. Warm compresses may also be used to increase circulation and to allow fluid causing swelling to clear faster. The sutures for incisional surgery are removed after 1 week. The early recovery period after double eyelid surgery is a time for many patients to be concerned, since temporary swelling can make the eyelid crease appear too deep and too high. It's important not to panic about the results during this time and to allow the healing process to transpire. Patients normally return to work in about a week after surgery, but active healing and resolution of swelling still continues past the 1 week point. The rate of noticeable swelling resolving varies between individuals, ranging from several days to a few months. Complete surgical healing can take up to 1 year. I follow my patients' progress closely after surgery with visits every 2 weeks to every month to 2 months for the rest of the year afterwards. Generally, I expect appearance to be close to the final result around 6 months. If a patient has a history of allergies, sinus problems, smoking, or other circulation issues, swelling can persist longer than is typical. Double eyelid surgery is a highly effective and successful procedure for Asians who are interested in having an eyelid crease with brighter looking eyes. It is important to understand that your individual anatomy determines how I design and create a naturally appearing eyelid crease that suits your unique facial characteristics. Look for a cosmetic surgeon with extensive experience with Asian eyelid surgery and make sure you have a proper evaluation with an understanding of the anticipated outcome for your eyes prior to any surgical procedure. I hope you found this information helpful. Thank you for your question.